20 to 21, I think everybody was like, all right, this is going to be over. We have a new year coming, everything's going to be hunky-dory, and someone's going to pull a rabbit out of the hat and we're all going to be fine. And that clearly did not happen. And I think it was foolish of us to think that it would. I think it was just that eternal hope of something's got to change, please, and it's going to get better. And now transitioning from 21 to 22, I think people have more of a realistic perspective that this is going to be a slow process. We understand risk factors much better now, and the pharmaceuticals are coming out with monoclonal antibodies that have been hugely beneficial, and some actual treatment plans for COVID instead of, I feel like for the first year and a half, we've been treating COVID behind the 8 ball, like trying to, whatever happens, then we react to that. Now I think we're transitioning to more how we have been in medicine of, we know how to treat this a little better, and we're gonna actually start treating it and looking for outcomes instead of guessing, is this gonna work?
It is hard to be a bedside nurse going through this. It is hard to continue to work in a hospital and deal with the day-to-day changes and deal with the mandates and deal with all of the things that have come down over the last couple of years. And I just wish the community would have less negativity and would separate whatever their belief about vaccines or belief about the politics or belief about whether COVID is going to affect them or not. I just wish there wasn't so much animosity when they come in, directed towards us. On any given day, I find joy at work, I'm optimistic, and then you take care of a really sick COVID and you're devastated all over again because you're tired of seeing your community members die of this disease. So some days you feel beaten down. And then some days you have a really good day at work and you don't see any COVID and you're laughing with your coworkers, and we all bring in food for a potluck, and it feels like community again because we're all eating and sharing and laughing and telling stories, and it's great. And you have these glimpses of what things felt like before all of this nightmare started. And so as we've seen more of that this fall and winter, I hope that continues forward and we're in this season of finding hope and joy, and that season's going to last for a while.
The 21 compared to 22, hopefully, again, will give us more of a definitive treatment plan for COVID and get rid of the emotion from this. And again, hopefully return medicine to the medical providers. And hopefully the public will realize that we have always 2020, 2021, and 2022, and in the future, we'll always have the best interests of the patients in mind, and not trying to drive my agenda to help treat patients, because that's not my job. My job is to provide the best health care with the best knowledge to the patients, and not have my little agenda I'm trying to do on the side. Yeah.
We're starting to laugh more again. We're starting to have fun at work together, like the whole team. So there's definitely a different feeling overall right now, because a lot of the big decisions are out of the way. As each new mandate or new thing came out and people were really struggling personally, it was such a black cloud over work. And now that we're past most of that, that's really helped.
This organization as a whole, I think, has done a good job in taking the mandates and the recommendations and tweaking it for our community, which I think has been a huge factor. And I think kudos to Jeremy and the administrative staff and the physicians who have been making decisions to customize care as best they can for our county. Whereas in bigger cities, they don't do that. And I don't think they have the luxury of doing that. So it's been nice to be in a smaller community to have that personal touch. I think 2022 is going to be good. I think as we go through the different variants of COVID, they're becoming less potent. And so I think that's going to be a huge factor just mentally for people. Hey, hopefully the fear goes away and the emotion comes out of it, and people kind of take a deep breath and try to, I don't like the cliche thing of get back to the way it was, because we can never go back. All we have is the present, and we can make the future better. So I think hopefully people will be looking at how can my life be better instead of I just need to survive today.